Good morning. This is Dr. Atti. I'm an interventional cardiologist at MCH. I've been with MCH for the last 8 months, and this is Ask a Doc. First question, what made you want to be a heart doctor like your family? So I grew up back home in India, and one of my uncle is an interventional cardiologist. Essentially, he's actually my partner right now. And looking back at my childhood, I grew up seeing him and being a cardiologist. And it inspired me a lot in my childhood, and I wanted to be one like him. So I went to med school, and my whole goal was to become a cardiologist. And at the end of the day, I made my dream come true. Second question, what's the difference between a regular heart doctor and an interventional heart doctor? So a regular heart doctor and interventional heart doctor, essentially both of them, they treat the basic cardiac conditions. And in addition, interventional cardiologists, they perform procedures such as stents to the heart, and I can do additional procedures such as Watchman devices and PFO closure devices. Can you explain the Watchman procedure in simple terms? Who needs it and why? So Watchman procedure is something that is done for patients with atrial fibrillation. Unfortunately, patients with atrial fibrillation have a risk of forming clots within the heart in a structure called an appendage. Everyone is born with it, unfortunately, and it's the place where clots form in AFib. And if someone is not able to tolerate a blood thinner for whatever reason because of bleeding issues, or if they had a fall, or if they had bleed in their brain in the past because of a fall, so those are some patients where we try to do the Watchman procedure, essentially trying to seal off that appendage with this device, and they will have to be on aspirin and another medication called Plavix for 6 months, and this gives them an opportunity for them to come off of the blood thinner. What is a heart catheterization and what happens during the procedure? So to explain heart catheterization in simple terms, there are essentially two types of heart catheterization. One is a right heart catheterization, and the second one is a left heart catheterization. So essentially, if you put any catheter in the arteries, it's a left heart catheterization. And to the left heart catheterization is something we try to look at the vessel supplying the heart, which is essentially the coronary arteries. And that's what we are trying to look in during the left heart catheterization. So right heart catheterization, it is done sometimes for people with pulmonary hypertension, and also sometimes who are really sick, who come to the hospital with symptoms of cardiogenic shock. So in that instance, right heart catheterization is something that helps us to titrate like medications, and also to see if the patient needs any additional support devices. What are some early warning signs of heart problems people shouldn't ignore? So one of the earliest signs I would say is chest pain is something that shouldn't be ignored, even in young patients. Unfortunately, I have seen a lot of young patients recently where I had to do some stents with support devices in young patients. So chest pain would be the first symptom, and shortness of breath, especially when you exert yourself. And chest pain, not being able to do what you were able to do a few months ago. So those are the initial triggers, and that should be some warning signs. Essentially, if you have some risk factors like hypertension or diabetes, or if you have a significant family history, I would strongly suggest seeing a heart doctor so that we can talk about some risk factor modifications and then what could be done better. How do you know if someone needs a pacemaker? What does it do for the heart? So we usually decide if someone needs a pacemaker depending on the symptoms and if they have heart rhythm abnormalities. So if you're passing out, or if you have symptoms of dizziness, or if you have some family history of someone needing multiple family members needing pacemakers, then those are some initial symptoms that you need to look out for. So if you have a heart rhythm problem along with passing out spells or feeling dizzy, so those are some things that we evaluate for. And if you have the heart rhythm abnormality confirmed on a monitor, then we talk to you about a pacemaker. What is a PFO closure and how does it help people? So PFO is something that everyone has when we are in mother's womb, and most often it tends to close down as soon as you're born, but at least in 10 to 20% of the people it tends to be open. So it doesn't mean that we close down every PFO we come across. So in patients who had strokes, and if there is no explanation for why they had a stroke, let's say we check the vessels in the neck and we check out the heart and everything turns out to be negative, and if you have a PFO PFO, then we talk to you about closing that PFO, which could be a cause for the stroke. So that it reduces the risk of having a recurrent stroke in the future. What does it mean to have an irregular heartbeat, and how do you fix it? So irregular heartbeat, it depends on what kind of a heart rhythm you have. So sometimes people talk about having skip beats and sometimes palpitations, noticing that you have an irregular heartbeat. So it only becomes an issue if it is associated with something called atrial fibrillation, or if you have so many extra heartbeats, like extra heartbeats, there are so many that could be causing your symptoms. So we do a monitor to figure out what kind of a heart rhythm it is, and depending on the heart rhythm, we treat you based on what we find on the monitor. What are some easy things people can do to keep their hearts healthy? So the best thing I would suggest is exercise is the best medicine. That's in simple terms. So I myself, I do go to the gym like 3 days a week. I try to find time myself, and exercise is the best thing, especially cardio more than strength training. Strength training does help, but cardio is the best exercise. At least like 30 to 40 minutes, maybe 3 or 4 days a week is really good for taking care of yourself. And of course, having all the labs checked, keeping your blood pressure under control, keeping your cholesterol under control, are few things that you can do to make sure that you're healthy for the rest of your life. What is pulmonary hypertension, and how do you know if you have it? So pulmonary hypertension is nothing but the pressures in the pulmonary artery that comes off of the right heart are elevated, and most often the symptom is you have exertional shortness of breath. So you're out of breath with simple things like even walking short distances, like going to the grocery store, you're out of breath. So sometimes pulmonary hypertension unfortunately can run in families as well, or if you had blood clots in the past, that can put you at a higher risk of having pulmonary hypertension. So this is also the place where we try to do the right heart catheterization after an echocardiogram to figure out how high the pressures are, and if any of it could explain your symptoms. What else would you add that the everyday person should know or consider when it comes to their heart health? So as I mentioned before, keeping your cholesterol under control, making sure that your blood pressure is well controlled, seeing your primary care every year to have annual health wellness exams, and having some screenings that are out there these days. So those are some things you can do right. And of course, as a heart doctor, like keeping yourself healthy, doing exercises every day, and at least 30 to 45 minutes a day for yourself, so that you can be physically fit, and also it gives you mental wellness as well.